Presence of proteins in the urine is one of the alarming situations which a physician encounters, and all of a sudden it's thought that the person has got some kind of nephropathy. So it's important that whenever you get a urine sample, proteinuria, if it is present, it should be interpreted correctly. Normally, we pass about 30 milligrams of albumin per day. When I'm going to talk about proteinuria, in fact, I'll be talking about albuminuria and proteinuria combined and not separate. And this is also equal to about 150 milligrams of proteins per day. And mind you, these proteins that I'm talking about are all kinds of proteins. They include albumin as well as other kind of proteins like the term horsefall proteins, which are the tubular proteins. So collectively, we tend to pass about 150 milligrams of proteins per day. But this can increase under certain situations to up to 300 milligrams per day. And those situations are like fever, exercise, hypertension, acute hypertension, certain medications, in heart failure patients. We can expect the proteinuria to be high. It's just like if you're making orange juice and you're directly applying more and more pressure on the machine, you will get more pulp as well along with the juice. And the pulp part is the protein which is coming in the glass. So the greater the pressure, the more likely the pulp will come as well. So these are the normal ones. But what you get in a urine test is something like this. You get trace plus 1, plus 2, plus 3, and plus 4. For all practical purposes, trace means that it's not serious. It's more or less it's normal. And trace is something like up to 30 milligrams. So when you quantify urinary protein, trace often equates to about 30 milligrams of protein, which is perfectly normal. So if you get a urine test which shows trace in it, do not panic, take a history, and where necessary, repeat the test after a few days, preferably in a fasting state, so that in order to remove all the other variables, all the other factors like exercise, etc., etc. And if trace is still present, you still don't have to panic. You must repeat the sample. You must once again go back to the drawing board and find out whether they have got some other cause of proteinuria. So practically, trace doesn't need to be. You don't really need to panic. Plus 1, plus 2, plus 3, and plus 4. These are significant. And it depends whether you're dealing with a male or a female. The females can have plus 1, plus 2 protein in the urine if they've also got simultaneously blood present in the urine as well. So if they're menstruating and they've got blood in the urine, they're likely to have 1 plus or up to 2 pluses of proteins in the urine. But in a male, 1 plus protein or more than that, this is significant. Uh, a protein of plus 3 means usually this is greater than 500 milligrams. A protein of plus 4 is 1000 milligrams. A protein of plus 2 is somewhere about 250 milligrams. And a protein of plus 1 is between 30 to 250 milligrams. So what this means is that plus 3 protein, most definitely, this is significant, and obviously it's more than that. If you've got plus 4 protein, it means that there is at least 1 gram of protein which is present in the urine, at least, because this is the limit of the dipstick. It can't go beyond that macroscopically. So if you've got plus 4 protein, it can be 2 gram, 3 gram, or even greater than that. In membranous patients, we can get really, really high values of proteins, but they'll show a maximum of plus 4. So if this is the case, this patient definitely has got nephropathy and they need further investigations, quantification of the urinary protein, and then they need investigations vis-a-vis probably a biopsy as well here. So therefore, a proteinuria is significant if it's greater than trace, plus 1, plus 2, plus 3, and plus 4. Plus 1, plus 2, this should be seen to whether or not this is coming in a male or a female, and whether there are any of the other variables. I'll talk about that in details when we touch on the hematuria section of the urine report, and then it will become clearer. Thank you.